Every year, hundreds of physicians gather in Sacramento for CMA's Legislative Leadership Day. It's an opportunity for CMA members to get updated on legislation impacting medicine, to hear from key state leaders, and most important, to meet face-to-face with their legislators to share the realities of working on the front lines of healthcare.
For all of you that come, it really is a meaningful experience, and I want you to know that. It's not just coming up here and spending a day. For the legislature, when they see doctors, their constituents, meeting with them and talking to them, it's a reminder that they actually are accountable to you. You're the voters, you're the people in the district, you're community leaders, and it really helps us in Sacramento keep them accountable and hopefully get more yes votes for the things that we want and no votes for the things that we don't.
A key focus of this year's event is protection of MICRA, the Medical Injury Compensation Reform Act.
MICRA is the law of the land that keeps malpractice rates for physicians in this state affordable, far lower than any other state, certainly much lower than those other major states. And in fact, that law has become the gold standard that malpractice reform is debated around. Every other state wishes they could get it, and we, of course, are here to defend it and protect it.
They have to protect MICRA, because if MICRA goes away, a lot of us would be leaving California.
This year's Legislative Leadership Conference attracted more than 500 doctors, including our future physician caregivers.
It's also good to have such a great turnout of residents. And could I ask, please, all the residents stand for us, if you would. I know you're there. There you are. Okay. And last but unquestionably not least, the medical students. Would you all please stand, because you are our future. And look at this turnout here.
I think it's important for med students because it gives them an opportunity to have their voice heard about some of the issues that they're concerned about and the way that the future of medicine is going to be practiced. I think we're all aware that we'll be the next generation of doctors, and it gives us an opportunity to form the medical field that we wish to practice in and have our voice heard.
I think it's important for med students to be involved in the political process and to have a voice and to talk to our leaders who are supposed to represent us and who are in our best interest, and to let them know what we feel is important.
Medicare, Medi-Cal payments are a very important issue for us. Also, increasing access to care is also something that I know that a lot of myself and my colleagues are all very concerned about. And just seeing that we really want to see the medical profession progress forward and not stay kind of stagnant where it is. We want to see it getting better and working more efficiently for the United States and the citizens of California. Well, I think you have to become involved with CMA because it's the loudest voice that we have at the state level, and it really does give us an opportunity to have our voice heard with our legislators and our representatives, and it gives us a very way of coming together as a profession and enacting change at the state level.